So what we'll be talking about today is, as I mentioned, the HWork project, and it's a Horizon 2020 project that we started on the 1st of January this year, and it's looking at interventions to promote and ensure mental health and well-being in small and medium enterprises and public sector organizations. And today it'll be myself and Carolyn that are presenting the results. There are 3 people in the UK team. Christian Vasquez has also joined us. He has just completed his PhD at the University of Manchester. So what we're going to talk about today is we want to give you an introduction of what the project is about, some of the principles and the theories behind the toolkit, and we'll be talking in particular about the needs analysis toolkit, and we'll be providing some examples of how this has been used in a large hospital in Italy. So very briefly, the process of the HWork project is that first we work with organizations to identify what interventions are needed, either at the individual level, interventions targeting individual resources, looking at group level interventions targeting teams within the organization, or leadership interventions or organizational interventions which are focused on changing work practices and procedures. So the first thing we do here is to identify which interventions are needed at each of these 4 levels, and then identifying interventions that can be used at these 4 levels, implementing them, and then evaluating whether they work or not, and in which circumstances they work, and what are the mechanisms for which they work. But today we'll be focusing on the first phase, because that's where we are in the project now. So it's how do you identify interventions at these 4 levels, and we'll start out with Carolyn talking about the toolkit, the theories behind it, and then I'll be giving you an example of how it has been used in an Italian hospital. So as I said, it's a Horizon 2020 project. We have 14 European partners in total, from Italy, Spain, Norway, Sweden, the Czech Republic, the Netherlands, Germany, Belgium, and the UK. And we will be implementing interventions in Italy, Spain, the Czech Republic, and the Netherlands and Germany. So now I hope that my dear colleague Carolyn can make the magic work and present to you our short HWork video. So over to you, Carolyn.
Okay, yes. So this is what I'm going to try to do. You might need to take down the presentation, Karina, and then I'll get this ready. So hopefully you can all hear this, but do say in the chat if you can't. So this is our video, which tells you a bit more about the HWork project.
HWork is a European Horizon 2020 project funded to promote mental well-being in the workplaces. Before we introduce ourselves, just answer a quick question. How do you feel at work? Sounds like a typical question, doesn't it? And yet, implicit in addressing this question, there are many pitfalls and many hidden answers. 14 partners from 9 different European countries have recently joined their forces to find answers to this question. Indeed, Europe has been faced with an increased incidence of stress-related mental health problems in workplaces, costing more than 4% of GDP. Symptoms of stress, overload, insomnia, depressive episodes, anxiety, and burnout syndrome are the most common mental health problems. Mental health is in fact one of the biggest issues in contemporary workplaces, involving everyone at the workplace, from the bottom to the top of organizations, and influencing not only productivity, but also the daily lives of individual working people, their careers, and even their leisure activities and relationships, from colleagues to family and friends, and eventually the efficiency of healthcare systems and the well-being of the society as a whole. Moreover, although almost 80% of European managers are concerned about stress and mental disorders, less than 30% of workplaces in Europe have procedures to deal with them effectively. This was the situation before the pandemic. Now that COVID-19's lockdown has completely changed our working habits, the challenge is even greater. Coordinated by the University of Bologna, the H-Work Consortium brings together broad, multidisciplinary expertise in advanced e-mental health solutions and communication. The project aims to design, implement, and validate effective multi-level interventions to promote mental health in 10 workplaces in Italy, Spain, the Netherlands, Germany, and the Czech Republic, reaching out to more than 1,500 participants. The project is divided into 3 phases: preparation, implementation, dissemination. First, managers, representatives, and employees report their needs and exchange perspectives on work demands and resources through a structured assessment method. Once H-Work partners gain a clear picture of the needs of each organization, preventative measures and innovative interventions are tailored and implemented at different levels of the organization based on the IGLU model. Interventions can be at individual level, such as mindfulness-based interventions and positive stress management. Interventions can be with groups, for example, increasing the efficiency of communication between the team members and their mutual support through digital solutions. At leader level, examples include training courses and workshops focused on leadership, or organizational interventions such as job redesign, job enrichment, work shifts rescheduling. The data is collected over time, and results will be securely stored in the H-Work databank. Validated digital and ready-to-use tools, solutions and guidelines for practitioners, managers and CEOs on how to best assess and create healthy, positive workplaces, especially for small and medium enterprises and public sector. On average, people spend 90,000 hours of their lives working. H-Work firmly believes that workplaces can offer a strategic opportunity to increase individual and organizational well-being and to maximize productivity. That's why we make sure to provide sound answers to our first question, so that we can hear you say, "I feel like a healthy worker."
Okay, so hopefully that's given you a bit of insight to the project and some background information. So as Karina mentioned, we're going to be focusing on that preparation phase today, so talking mostly around the needs analysis tool. But I just wanted to give you some principles and some of the theory behind this toolkit. So the key principles that we're working on is that work-related well-being is the result of interaction between demands and resources within the workplace, and this is based on the job demands resources model, which I'll explain a bit more about in a moment. But the idea is that there are some things that are draining and demanding in work, but also things which are beneficial and provide us with energy, and we want to retain some of those aspects as well. So there's this balance. The other principle is that employee participation is really important in these processes. Employees should be involved in identifying the wellbeing needs because they're the ones experiencing it. They're the ones who are at the coalface dealing with the work on a day-to-day basis. So they have a good understanding of the demands and the resources that are there. But also in terms of development of solutions, people are much more likely to be accepting of the solutions that are put in place if they've had a role in actually choosing those, and it's much more likely to be successful if people have had a role to play in this whole process. The other thing that it's based on is this idea that solutions should not just be focused at the individual level. So many organisations do this where they focus on coping strategies for individuals, for instance, trying to enable them to cope better with a stressful environment, but without doing very much about the other aspects of work that could be improved, perhaps at the leader level, in terms of leadership behaviour, organisational level, or the group. So the idea is that you need to have these different levels intervention available, because if you only focus at the one level, and particularly at individual level, it's very unlikely to have a long-term effect in and of itself unless you do something else to change things at these other levels as well. So I'm just going to go through the job demands resources model. Some of you may already be aware of this model, so apologies if you are, but the idea is that there are demands within work. So these are components of work which are that require effort, psychological effort, physical effort, and they've got physical and mental costs. So these will eventually lead to exhaustion if left unchecked. But there are also aspects in work which are considered to be resources. So these are things which help in the achievement of work goals. They might help to reduce demands, and they also help to stimulate growth and development. So that's things having social support, control and feedback within the workplace. The demands might be things like role ambiguity, role conflict, job insecurity. But the resources can be beneficial in that they will lead to engagement over time as they help to provide energy. But low resources can also be problematic as well. So if you have low job resources, then this can also deplete the resources that you have, and can lead to exhaustion in and of themselves, and also can reduce engagement, leading to disengagement. So this really emphasises the need to consider these positive aspects of work and ensure that these elements are maintained and enhanced, because too little of them can also be damaging. But also these job resources can be beneficial because they can help to buffer or reduce the impact that these demands, or these damaging demands, might have on work. So they can help reduce the impact that these job demands have. So for instance, if you've got the autonomy to face these demands as and when you feel appropriate, then they're much less likely to lead to exhaustion, because you've had a better chance to deal with them using the autonomy that you have. Now, the other complicating thing is that actually not all job demands are bad. There may be some demands which are also beneficial. So, for instance, things like having problem-solving demands or job complexity, which can be considered challenging, can also help you to feel more engaged and motivated at work, so could lead to engagement. But at the same time, if these are at too high a level, they could cause exhaustion. So it's important to get the balance right. So this model really shows the impact of these sort of two different components of work, the demands and the resources, and the need to try and balance these. And this is something that we've really put to work within the needs analysis. It's something that we need to focus on. So the needs analysis toolkit, then what we've got is sort of three main phases really. The first one is focusing on employees, looking at the demands and resources that they're facing and the particular needs that they have. So this is done in a focus group with employees. And then there are also interviews with middle managers and senior managers to get a more contextual analysis of what's going on and the processes that occur within organisations which might help or hinder a healthy workplace. And then the needs and the demands and the resources that are identified within that workshop are then brought to a stakeholder meeting. We have two of these stakeholder meetings, and I'll talk about those in a moment, where we review the needs analysis and then think about action planning and how we're going to implement new interventions to deal with those. So the focus group with employees, this is really to gain a mutual knowledge of the different things that are affecting mental health and well-being within the workplace, and identify the needs and actions going forward. So we'd usually do this in a 2-hour workshop, about 5 to 10 people, and again having a real mix of people involved in this. So you might have a safety representative, union representative, some key employees from the department, getting a good sort of mix. So you've got mix in genders, age, tenure, different responsibilities, etc. within the group. And it might, depending on the size of the organisation, you might only have one of these if it's a small to medium-sized enterprise and there's not that many employees. But in much larger organisations with multiple departments, you might have several of these groups. So to get at these particular issues. And we do what's called a cognitive mapping exercise, which we'll talk about in a moment, where we're looking at the different jobs, demands and resources, what contextual factors might be affecting the demands and resources people are facing. They're looking at the working mechanisms, so what are the causes within this, and also making suggestions for what we can do about that at the different levels as well. So the first thing we do within this exercise is we have a load of post-its available in red and in green, and we ask a key question of them. First of all, sorry, we would show them the job demands resources model, because just to make sure they're aware of what demands and resources are, so they get educated in that. And then we ask the question, what are the key issues for you in your workplace? Write down what demands you're facing on a red post-it note, and any resources, things you want to keep within the organisation on a green note. So we get them to do that first of all, and we don't show them the map that I'm going to show you in a moment. We show them that afterwards. The reason we don't show them before is we don't really want to bias what they say, and then afterwards we'll get them to map what they've said onto the map itself. So the facilitator, after they've done this initial exercise on their own, they will then have the facilitator will then show them the map, and then they will go through an exercise of putting the post-its on the map, and then they'll park any that they're not sure about to discuss later. So this is the map that we have used. So these different cogs represent the different levels that on the IGLO model. So the sizes are not meant to represent importance, it's more levels of analysis, with the lowest level being individual, that's the I, the G being the group, the L leader level, and then the highest level is organisational, which is the big cog. So all of the smaller cogs fit within that. So the idea is that people then put their demands and their resources against whether they think it's an individual level thing, so which might be about work-life balance, for instance, or particular demands in their job. There might be things at the group level, such as interpersonal relationships with co-workers. There might be things at the leadership level in terms of leadership behaviour or relationship with the leader. And there are things at the organisational level as well, in terms of the policies and practice, the culture, etc. And there might be things that they put in that park issue in the bottom right-hand corner because they're not sure where to put it, and they'll discuss that then with the facilitator and with the rest of the group. So Karina will give you some examples of how they've actually done this in a moment, so do bear with us. So the next bit is to then try and look at what are the relationships between these different bits that have been put on the map, discuss any park statements, where could they fit, are there any overlapping themes or conflicting statements, you know, that we could maybe put together, what are the possible root causes. So the facilitator will draw lines between different things. So for instance, leadership behaviour might be a root cause of perhaps some of the demands that are occurring at the individual level, so there might be arrows drawn between those two components. And because we've been doing this during COVID-19, we've also asked people to say if there have been any specific issues related to that as well. So after this, there's a group discussion, and you know, what are the main things we want to keep, what are the main things we want to improve, what's the most important, what would be the priority, and what resources are needed to try and implement those. And then this is then all the information is recorded and put into a report, which again I'll show you in just a moment. So I'm not going to say too much about the interviews with middle and senior managers, but basically these are to gain a bit more of an understanding about, you know, what are the attitudes to mental health in the particular workplace, what are the sort of hindering factors, what are the facilitating aspects, what are the roles of the leaders within the workplace in terms of mental health, what are the barriers and triggers and that kind of thing. So this gives you a different perspective, but an important perspective in terms of looking at what the context is that we're trying to implement these particular interventions in. So after all this data has been collected, then we'd produce a summary for the needs analysis. So that would then look at the different levels of resources and demands at the different individual, group, leader and organisational level. So you can see here, for instance, at the individual level, there's some resources identified, such as autonomy, but the demands is workload, for instance. There have also been some COVID-19 issues related to job security. Also, what have been suggested by the middle managers and the senior managers as well. So all this summary is then brought to the next phase, which is the stakeholder meeting. So stakeholder meeting, this will be members of the organisation, so a whole range, so from more senior management through to middle management, employee representation as well, HR leader perhaps. There may be some people who have been in some of the other activities, but they may be new as well. So again, you'd probably start off with the JDR model, giving them an outline of what the resources are and what demands are, and then present the main needs analysis first of all, and the report that you've made. And then there's a chance for reflection of these. And are there, you ask questions such as, are there any surprises? Are there any overlapping themes? Anything that people thought was missing? Is there consistency across the department? So if there's been several departments involved, for instance, you might want to look at whether there's been any consistency. Are there consistency across levels? And also thinking about what are the relationship between some of the needs identified and organisational goals, for instance. And then writing down, the group would then write down what are the key needs that they see as being presented from the different needs analysis summaries that have been brought to them. And then there's a process in step 2, there's prioritisation. So this is where, again, we use some nice post-its. We would try to pick out 3 issues that the organisation feel they need to preserve and do more of. And 3 issues on things they would like to improve as well. And then there might be certain things at this stage that need to be parked, or they don't have, they're not sure about at this particular time. But at the end of that first meeting, there should be a set of priorities ready to go to the next stakeholder meeting. And then with the second stakeholder meeting, this is where we start to look at those prioritizations and think, well, okay, so what interventions at the different levels might help to intervene and either promote some of the things we want to keep or reduce some of the things that we want to have less of, or things we need to improve. So this is where we need to get to sort of the action planning phase, really. So we look at, I think the thing to be clear about is that there might be a particular need. So let's say autonomy has been identified as something that individuals would like more of, and that could be addressed at several levels. So that you might need some job redesign at the individual level, for instance, and maybe some training at the individual level relating to using more autonomy, but also it might involve leadership training, so that leaders are able to support people having more autonomy, for instance. So there might be several different levels at which you might need to address particular interventions. Then you need to think about, so how do the interventions we've chosen fit the needs that we saw in the first workshop? So there's a bit of a checking exercise to make sure that there is fit between those, and also whether they fit with the priorities and objectives of the organisation as well. So then that's an exercise that they do, and then there'll be some action plans produced about, when are we going to do these interventions, who's going to be involved, what the different levels within the organisation will do to try and address these particular issues. And again, what we found in research is that if we can have everybody from the different groups contributing to the implementation as well, that it's more likely to be successful because people feel they have joint ownership of those. So I'm going to, that's an overview of the process. So I'm going to move on to, well, this is a sample action plan as well. Again, it's just giving you a bit of a template of how you might potentially log down your actions and who's going to be responsible and when things are going to be done, etc. But I'm going to move on now to Karina, and she would give you an example of where this has been done within an organisation.
Thank you very much, Carolyn. And I just wanted to say thanks to everybody for asking questions. I can see that someone has also raised their hands. We will get back to the questions at the end of the presentation. And I think in my part of the presentation, I will be answering some of the questions that have already come up. So basically, what I'm going to be talking about is the collaboration between the University of Bologna, our Italian partner and the lead of the Horizon 2020 project, and a public hospital in Italy. So just to give you an idea of what the process has been up until now. So we started up in July, working with the organization, getting a list of an overview of how many people were in the different departments within the organization, identifying which worker safety representatives would be involved in the project. In Italy, it's the safety representatives who have the overall responsibility or engagement with mental health and well-being. In other countries, such as Denmark, it's union representatives, but in Italy, it's safety representatives. So in each country, we identify which are the appropriate worker representatives to be involved in the project. Then there was a meeting with the hospital management and the safety representatives where they were introduced to the project. Then there was a preparation of the needs analysis materials and the recruitment process within the university from the research team. They would then get in touch with the hospital and discuss how to ensure a good ethical process, the GDPR process. Then Bologna went back and set up a meeting with the new Director General, and they agreed a communication plan. Then in September, we started data collection, as outlined just by Carolyn. They had 4 focus groups and 21 semi-structured interviews. So this is obviously a hospital, it's a large organization, which meant that we had more than 1 focus group, and we interviewed more than 1 senior manager and 1 middle manager. I'll come back to you how many we interviewed, or they interviewed, a little later. And then on the 5th of November, there was the first stakeholder meeting that Carolyn also mentioned, where Unibo presented the results, and the hospital chose and planned the implementation of interventions. And they last week on Thursday, they had the second stakeholder meeting where they fleshed out the interventions at the 4 levels. So just to give you an overview of how many were interviewed, I've both got the figures here for how many were invited and how many were attending. And you can see that the figures are quite good for line managers in the 3 departments of the hospital. In terms of focus groups, not everybody who were invited attended, but as you can see, in terms of senior line managers, it's quite good representation, whereas perhaps for employees, we have to admit, it's not as we would have wanted. So that's an answer to one of the questions, I think. But definitely, when you have large organizations, you want to roll it out within the department to make sure that you address the needs of the department. So as Carolyn mentioned, there's a steering group committee within each organization. And here in this particular hospital, we have the health and safety manager represented on the committee, together with worker safety representatives. And their job is to plan and implement the communication strategy. And they also take part in the contextual measures collection and the 2 stakeholder meetings. Also on the steering committee are the 3 directors of the 3 departments, and they are involved in ensuring that employee participation happens throughout all phases of the intervention and to ensure that the project fits with the organization. In terms of the specific communication plan within this organization, it took place at 3 levels before the needs analysis started. So the health and safety manager and the directors of each department sent the communication to all participants in the 3 departments, where they described the HWork project. The general director also sent a communication about the needs analysis to those who were engaged in the workshops, in the focus groups, wanting to demonstrate his commitment, saying that this is a really important project for the organization. And then they distributed a generic HWork leaflet about the project itself, and also specifically about the needs analysis. And then they were also sharing the official HWork video that you've just seen on the internet. So the next steps after that, after the focus group had been conducted, was to send a summary of results to the general director and develop a leaflet of the main results to be shared amongst all participants, whether they had participated in focus groups or not. And then, of course, action plans need to be shared with the directors of each department so they can communicate it to the 3 departments. So this is an example of a cognitive map. And you can see there are some red post-it notes and some green post-it notes. So the important and positive aspects of the job that was reported in this focus group in Department 1 was intrinsic job motivation. People were really passionate about providing good care to patients, and they really cared about their jobs. They also reported that there was good team cohesion, and there was positive collaborations and cooperations and relationships with colleagues. Some of the negative aspects of the job was that there's poor work-life balance. They didn't feel committed to the organization. They didn't feel part of the organization. There were problems with aggressive customers, so patients' families, and they were not being understanding of specific healthcare roles. At the group level, there are issues around top-down decision-making with regards to holidays and leave and work shifts. And there's a perceived lack of workplace health practices and organizations. Oh, sorry, that's at the organizational level. And then there's a high and disproportionate workload where nurses reported that they have had particularly high workloads. And there's also staffing within the hospital. At the leader level, there's a perception of a lack of leadership, lack of clarity in the communication, and lack of recognition of employees. So that's one example of a cognitive map. I'm just going to flick through the next 2 departments, but you can see they went through the same process, and there were some of the same issues that came up, managing patients and their relatives, for example, a lack of communication within the organization. So some of the same issues, but also some that differed from organization, from department to department. And as you can see, Department 3 had a lot of both green and negative aspects. But again, some were different to the previous departments, and some were shared across 3 departments. So then we move on to the stakeholder meeting results. So once that they had held the interviews with line managers and middle managers and conducted the focus groups, the Unibo team analyzed the results and they fed them back the stakeholder meeting. And to summarize what came out of Department 1 once they had the results. The steering committee identified important resources to be work engagement, intrinsic motivation, good team support, good relationships between colleagues, a shared vision and identity for providing good healthcare. They also thought it was a resource that the Health and Safety Department was actively involved within the department. And here they found it positive that there was bottom-up decision-making involving senior managers. In terms of the demands they perceived in Department 1, emotional demands, management of shifts and days of leave, responsibility and communication overload, top-down processes about holidays and work shifts, and unclear organizational communication. So you can see the link between the cognitive maps and the summary of the department. In this meeting, they also came up with suggestions for what could be done about these issues, and some of the suggestions were continuous and structured mental health counseling, mental health initiatives also at the group level with focus groups between peers, promote bottom-up approaches for job rotation and job shifts to address the issue of top-down decision about holidays and work shifts, and then training on effective communication skills from employees to patients and patients' relatives, but also from leaders to employees and from the organization to all, and also between departments. So overall communication. Some similar issues in Department 2 and 3, and some were different. So the next step was then to prioritize, so what are we going to focus on? And basically they were asked in the stakeholder meeting to say these are the 3 things we want to preserve, these are the resources we want to facilitate and strengthen, and these are the 3 aspects that we want to work on to manage the demands better. So in Department 1, what they wanted to preserve and strengthen is a shared vision and identity for providing good patient care. Continue to be motivated about the job that they have, and they wanted to promote and preserve the cohesion and the supportive teams in the department. In terms of what they wanted to improve was training on effective communication skills, with a particular focus on how staff in the department communicated with patients and patients' relatives to set expectations about what care could be expected, and from leaders to employees, and then also focusing on emotional demands related to the job. So these are the kind of suggestions that they then came out of the stakeholder meeting last week. And as you can see, they have developed interventions at all 4 ECLO levels. So the first intervention they agreed on is a Hello Better training, individual training, and that's in response to Jenny's question. So there are interventions that are focused specifically on COVID-19. So this is basically an individual training intervention that focuses on equipping individuals to deal better with the COVID-19 situation. Successful problem solving. How do you consume all the information you get from the media? How do you maintain social contact in this very stressful situation? Relaxation exercises for body and mind, and dealing with difficult thoughts and feelings about the COVID-19 situation. At the group level, also targeting the individual and the leaders, they decided on an intervention called social mapping. On the next slide, I'll tell you a bit more about that, but it's basically a way of improving intra-team and interdepartmental communication. Then at the group and organizational level, structured peer support meetings on mental health, and empowering personal and job resources. This is tailored to the organization, so we don't necessarily have identified interventions about that. They will have to be developed. And the same with the leadership course that should focus on empowering leadership, bottom-up approaches to leadership, and improving communication skills. And then they also wanted to develop a toolkit to be made available to staff that introduces self-help tools and guidance on mental health digital tips, and that addresses the individual, the leader, and the organizational level of interventions. So what is the social mapping? So the social mapping is basically an online tool that allows you to identify how is our team or our departments working together. So if we take Carolyn and myself and Christian, we can be asked up to 5 questions about, for example, communication or social distance or psychological distance. So for example, we can be asked about who do you communicate with on a regular basis? And it may turn out that Christian and I are communicating more than we are communicating more with each other than we are communicating with Carolyn, and then we can discuss that's the reality. But is that an effective way of communicating? Should we do something else? Then you can develop an action plan for communicating differently, and you can evaluate in the tool itself whether we're actually changing the way we communicate together. Just to give you an overview of where the plans are heading in the hospitals from here. The plan is to start the Hello Better individual training in February, March, and do the initial social mapping survey, so asking the 5 questions. Then in April and May, having social mapping workshops where they develop action plans and discuss what are the results, run the leadership training courses, have the training for empowering personal job resources, and running the structured peer support meetings. And then later on, after the summer holidays, have the relational and communication skills courses and introducing the self-help toolkit. In terms of the evaluation of the project, we have a baseline survey going out in January, and we will have the first follow-up at the end of October. And we have also planned 3 monthly process evaluations, so basically checking up on whether interventions are implemented according to plan and what the processes are. And the plan is also to feedback that process evaluation to the organization in a short report, so they can discuss is the intervention going according to plan, or do we need to do something differently from what we've done up until now. So that was essentially what